When you think about climate change, you're probably picturing, rising sea levels or extreme weather, right? But today, we're diving into this explainer to look at how those physical shifts are quietly rewriting the rulebook for one of the most data-driven industries out there, managed care. We are going to look at this purely through an actuarial lens to unpack exactly how health insurers are being mandated to report on and prepare for a rapidly shifting global health landscape. So it's really the ultimate risk modeling question. When the physical environment itself changes, how does that disrupt the highly calculated business of health insurance? Insurers rely heavily on past data to predict future costs. But what happens when the past is no longer a reliable predictor of the future? How do managed care entities, companies whose entire business model relies on accurately pricing health risks, adapt when the fundamental variables of human health literally begin to shift underneath them? That's the complex puzzle we're exploring today. Here is our roadmap for today. We'll cover climate change and human health, the managed care business risk, geography, morbidity, and mortality, mapping specific health threats, and finally, strategies and risk models.
Let's kick things off with Section 1, Climate Change and Human Health, the Physical Reality. To really get how the industry is handling this, we've got to look at a very specific reporting metric from the Sustainability Accounting Standards Board, or SASB. It's metric HCMC450A1. Now, this metric forces managed care companies to take their heads out of the sand and explicitly disclose their strategies for a changing world. And we're not talking about vague environmental pledges here. It's a strict requirement to discuss how climate change affects core business operations, and critically, how they are tweaking their underlying risk models to account for these massive environmental changes.
What's fascinating about the SASB standards framework is that it requires entities to impartially evaluate these environmental shifts purely as objective business risks. It totally strips away any political or social commentary and forces actuaries and executives to look at climate change through cold, hard financial metrics. Investors absolutely need to know if a health insurance provider is accurately forecasting the physical realities of the next decade, and the standard ensures that data is put right on the table. Moving right along to Section 2, the managed care business risk and how it ripples into healthcare. Okay, so here's the dual-sided risk the standard highlights. On one end, you have the physical trigger, an increase in extreme weather events, coupled with things like food and water scarcity and the spread of infectious diseases. Naturally, this leads to an increase in patient encounters with the healthcare system. People get sick or injured, and they go to the doctor or hospital. But that physical reality directly shocks the business side. More encounters mean more claims paid out. That threatens revenue margins, it drives up operating costs, and ultimately, it can make the health insurance plans themselves way less affordable for everyday consumers. It's this direct, unavoidable ripple effect from the physical environment straight to the corporate balance sheet. Which brings us to Section 3. Geography, morbidity, and mortality, tracking the metrics of disease. This is absolutely crucial to understand. According to the SASB standard, entities must incorporate changes in 3 highly specific metrics into their risk models. Step 1 is geographical incidence, literally where the illness is happening, because as environments change, diseases don't just stay put. Step 2 is morbidity. So the incidence rate and prevalence of a disease in a population. Basically, how many people are getting sick and how sick are they getting? And step 3 is mortality, the actual death rate associated with these illnesses. Managed care entities have to publicly report exactly how they are adjusting their algorithms and strategies to address the business risks coming from shifts in all 3 of these specific variables. Next up, Section 4, mapping specific health threats, taking it from abstract models to concrete risks. Straight out of the SASB documentation, this matrix is exactly what risk modelers are staring at all day. Rising temperatures, they aren't just uncomfortable, they create measurable spikes in allergic responses, asthma rates, and heat-induced illnesses. Just think of the surge in emergency room visits during a major heat wave. And warming climates mean tropical diseases like mosquitoes carrying malaria and dengue fever are migrating to regions where they historically just haven't been a risk factor. That completely alters the geographical incidence we just talked about. Next, natural disasters predictably lead to spikes in waterborne diseases, such as cholera, as local infrastructure gets compromised. Finally, decreased food availability can increase rates of human developmental diseases like malnutrition. So a changing environment directly populates an actuary's spreadsheet with new, very real health claims. And notice where this climate change metric actually sits within the broader standard. This is not some fringe optional topic. It's positioned right alongside massive, traditional industry concerns like customer privacy, access to coverage, and plan performance.
It's considered totally fundamental to the long-term sustainability and viability of a managed care business.
Finally, Section 5, Strategies and Risk Models, the Corporate Response. Under the standard, managed care entities can't just spot the risks. They must disclose their specific strategic business approaches to actually address them. They have to publicly project what these climate-driven health trends are going to do to their revenue, their operating costs, and overall plan affordability. But honestly, perhaps the most important part is that they have to explain how they incorporate these effects directly into their risk assessment and risk adjustment activities. If a region is newly prone to vector-borne diseases or seeing respiratory issues due to prolonged allergy seasons, those internal risk models must be adjusted for the shifting geographic disease burdens. It's a constant, rigorous updating of their mathematical reality. Ultimately, this entire reporting framework boils down to this exact phrase from the SASB standard. It says, entities that manage the risks posed by extreme weather events and potential changes in the incidence, morbidity, and mortality of illnesses and diseases may protect shareholder value better. Why does this matter to you as a consumer, an observer, or an investor? Well, because in a highly volatile, unpredictable physical environment, the companies that accurately measure and adapt to how human health is changing are the ones that are actually going to survive financially. It's all about resilience, plain and simple. So I'll leave you with this final thought to chew on as we wrap up our explainer today. As these geographical impacts accelerate, and as baseline rates of morbidity and mortality for various diseases continue to shift, how will the insurance industry adapt to accurately price the future of human health? It's a process that requires continuous, absolute innovation in data science and risk modeling. And thanks to these reporting standards, it's a reality we actually get to watch unfold in real time.